Good afternoon and welcome to our Facebook Live event here at Massachusetts General Hospital. Today, in honor of the National Donate Life Month, we're going to have a discussion about transplant surgery, organ donation, and answer any questions that you might have. Please be aware that Mass General will be live streaming this discussion today as well as recording it to put on social media. The Mass General staff is trained in patient safety and privacy, but this presentation is for informational purposes only, and if you have any questions about your specific health care, we encourage you to reach out to your personal physician. I'm Dr. Chuck Rickert. I'm a resident here at Massachusetts General Hospital, and today I am joined by Dr. Leigh Dageforde, an assistant professor in surgery at Harvard Medical School and a member of the transplant surgery team. Dr. Dageforde.
Great. Well, I'm really excited to be here. I've had really wonderful experiences training at Vanderbilt and Nashville, and then I was at WashU in St. Louis, and now I've been here at Mass General for about 7 months, and it's really a great opportunity to chat with you about the opportunity for organ donation during Donate Life Month. So
wonderful. Yeah,
glad to
great.
be here.
So let's just go ahead and get right into the questions. Let's first just speak broadly. Tell us a little bit about the need for donors and for transplantation in the United States.
Sure. So currently there are 113,000 people approximately right now waiting for an organ transplant, and 20 patients die every day while they're on the wait list for organ transplantation. So that doesn't even include all the patients that may have end-stage kidney or liver disease or heart failure that don't even make it to the list. So there's a huge need for organ donors.
Yeah. And can you tell us a little bit about what organs are typically donated and which ones are sort of in the most demand?
Sure. So right now, I would say about 80% of the wait list nationally is waiting for a kidney. And so there's a huge demand for kidney transplant. Thankfully, there is the option for dialysis for patients that have renal failure, but it really doesn't, it works about as well as 20% of your renal function.
Right.
So it doesn't work great, and patients do die on dialysis, so people really need kidneys. The other 20% of the wait list are waiting for hearts, lungs, or liver transplants, and those patients, there is no replacement organ. So those people, if they don't get a transplant, they will die without their transplant. So the need is there in many different ways.
Yeah, and so I know that there's two types of donors. There are deceased donors that have died, and then there are living donors. Can you tell us a little bit about how you register for those to become a donor in those circumstances?
Sure. So for the deceased donation, many people know about signing the back of your driver's license, but you can actually go to a website called registerme.org and sign up there. You should talk to your family members about your wishes should something happen, so that they're aware. But we do know that when people register to donate, which right now only about half of the country is registered, that there's a much higher rate of them becoming donors. So this is a really important thing that you can do to save lives and have the opportunity to keep living and giving even in a tragedy. Right. The other way that you can donate is to be a living donor. And so one way to sign up to do that, you can actually go to the Mass Gen website for donation and start signing up through the process there. And that's a really great way to get involved as a living donor.
Great. And are there restrictions on who can become donors, or who are the sort of
Sure. So I think for deceased donation, I would say anybody is a candidate because there are so many things that you can donate. Actually, not only organs, but people can donate corneas and bone and skin. And so I think anyone really could be considered for deceased donation. For living donation, we're a little bit more picky just because we want to make sure that our living donors have a full, long life ahead of them. But I think the best thing for people to do is just start the process, because you never know if you may end up actually being a candidate. So we generally want young, healthy people, but we've taken living donors even up into their 70s if they're strong and healthy. Right.
And are most of the living donors, are they related to the individuals that they're donating to?
Right, so I would say that is the case sometimes. So we do have parents that donate to children, or children that donate to parents. Siblings can donate to each other. Right. But actually, I think the majority of our donors are not necessarily blood related. So we may have spouses that donate to each other, but they have no biologic connection. And then there are friends and family that can donate to their loved ones. And if people aren't a blood type match, we have ways around that through these really neat organ donation pools where we can actually pair people who are maybe not a match with their donor, and there can be a swap so that everybody actually can have a living donation through the process.
Wonderful. And we just got a good question, just came through. So how long does the process take to find out if you're eligible to be a living donor?
So it's really great. You can go to the Mass General website and sign in, and there are some screening questions there, and there may be some categories that would maybe tell you right away you may not be a candidate. Once you kind of get through that initial step, then we go through a whole process. You meet our kidney doctors, our nephrologist, meet social workers, financial coordinators. We do some basic testing, and then the process just kind of moves forward. So I would say definitely within 1 to 2 months we would know for sure if you are a candidate to be a donor, and then like I said, we may put you in a swap if you're not a perfect match for your intended recipient.
Got it. Oh, that's good to know. And could you tell us a little bit more about what organs you are able to safely donate as a living donor?
Sure. So living donors, as far as whole organs, they can donate one of their 2 kidneys. Because we actually only need 1 kidney to survive. A piece of the liver can be donated, which is a wonderful gift. And then people can also donate stem cells. You can donate red blood cells, plasma, platelets. So those can be donated without even having to undergo an operation. Right. And then in very selective circumstances, maybe people could donate a piece of their lung or their intestines, but those are far less common than the kidney and liver option.
I see. Right. So you talked a little bit in response to the earlier question about how long it takes to find out if you're eligible to be a living donor. Can you tell us a little bit more about the process after that, after you're sort of plugged in and going to be a donor, and what the operation's like a little bit in post-operative care?
Sure. So I do these operations, and I would say overall it's really important to know that the patients do great. So we see them back about a week after surgery, and I think that my donors are strong and recovering really quickly. So the surgery itself is a minimally invasive procedure. So we make a small incision about where a C-section scar would be for a woman, and it's about 2.5 to 3 inches long. And then there's 2 to 3 other incisions that are all less than an inch. And we use cameras and instruments to carefully remove the kidney, and then we sew up the incisions. There's actually no staples or sutures that have to be removed, and so it's a fairly quick process. And patients usually go home not the day after surgery, but the next day after that.
Wow, so just in the hospital for a couple of days.
Just a couple of days, and actually some of the patients don't even end up needing narcotic pain medicine. We have a fair number that go home and just use Tylenol and kind of get back to the normal life. Yeah,
and another question from the audience is asking about if there's any sort of age cutoff for being a living donor, or if there's either end, minimum age or maximum age.
So we only consider adults to be living donors, and like I said, we have had living donors up into their 70s, so it's more about general overall health. Like I said, we want to make sure that patients don't have risk factors that would maybe make them need their second kidney later on in life, so that may limit people more than age.
I see. And the procedure itself, you mentioned, is very small and just a couple of inches. Has that been how it's always been, or has the surgery really progressed over the years?
I think the surgery has changed a lot over the years. So originally the incisions were quite large, and they were kind of flank incisions, so they went all around the side of the patient to remove the kidney. And I do think that this minimally invasive technique has really benefited patients and sped up the recovery for patients.
Oh wow, okay, that's fascinating. That's great.
So I actually have this really unique opportunity, and you didn't share this at the beginning, but I get to become the interviewer now, and I know that you actually were a donor of a kidney yourself several years ago. So do you mind just telling the audience here a little bit about why you chose to become a living donor?
Yeah, no, I'd love to. And honestly, it seems kind of silly to say, but in some ways it just felt like it was the right thing to do. I was listening to a discussion on the radio that's not too different from our discussion today, and it was about transplantation, and really highlighted the risks for the donor and the benefits for the recipient, as we've talked about, which are just enormous and really give back that life to the patient. So I just kind of thought to myself, hey, this is maybe something I could do, and kind of always felt an obligation to help when I can, and it seemed like a small thing I could do.
And
So.
did you know the person you donated to? You asked me the question about, being related. What was your experience with
Yeah,
that?
so in my situation, it was a non-directed donation, or it's called an altruistic donation by some people, but it was not to someone I know.
Wow, so you just gave to somebody on the list that was in need of a kidney?
Yeah, it was someone, it was a pediatric patient ultimately, but it's about all I know. No.
And how does that impact you now on a day-to-day basis? I know you have a busy life, researching like crazy, being a surgery resident.
Yeah.
What is this donation done to your lifestyle now?
Right. So the donation was 10 years ago. At that time, it was right at the time of the operation, it was pretty painful. I realized I don't like pain very much, but I was back to work 10 days after that with a lot of support from my family and friends. Really after a couple of months, I was kind of back to my baseline level of activity, and it really does not impact me on a day-to-day level.
Wow. So you do think about it, when you're going about daily life?
Because I'm so involved with the transplant center here, I do think about it quite a bit, but when I'm not here, it doesn't really pop up. So.
And then we hopefully have some people in our audience today that are watching, thinking about potentially giving the same wonderful gift that you gave. Do you have any advice for someone who may be considering being a living donor?
Yeah, I think the first thing I'd say to anyone who is considering being a living donor is just thank you for making that consideration. It's not an easy thing to consider, undergoing an operation that you don't need.
Right.
But I think that most important is just to get all the information that you possibly can. Talk to multiple donors, talk to people involved with transplantation, just to sort of understand fully what the experience is like. Get all of the information regarding the potential risks. The risks are very small, but they're not zero. And I think that everyone in the transplant community wants all of the living donors to be completely comfortable going through with the procedure, and that's what I want them to have as well.
That's great. Well, thank you for sharing your experience today and for being here to talk about organ donation. I have a very unique opportunity to invite our special guest to join us. So I would like to introduce Dr. Paul Russell, who is been here at the Mass General Transplant Center, and it's just an honor to have you here with us today. So do you mind telling our guest a little bit about yourself and your experience and how long you've been here?
Thank you, Dr. Dageforde. It's been a great and long experience. I've actually worked here at the MGH for 70 years.
Oh my goodness.
And transplantation doesn't go back that far. I can easily remember the time when patients here and around the world were dying for lack of any support. There was nothing could be done for them. And it's been such a remarkable change to see that happen. One of the biggest obstacles to successful transplantation, of course, was the phenomenon of organ rejection. And we didn't know how to handle that in those days. But along came some medicines that worked a little bit, and we thought it was good enough so that we could give it a try. And that we did in 1963. I did the first organ transplant here of a kidney. But in those days, success rates were pretty low. And actually the majority of the patients failed to reach it to 1 year. And so there's been extraordinary progress. New medicines have been developed, new techniques have been developed, and now we get to the point where we do 5 types of organ transplants here, as you know, and the success rate is over 90% for a year. So it's been extraordinary progress. In the early days, all of the donors were living donors, of course, from families, because they were the closest and the most involved, and the risks for the recipient were high, and it wasn't clear how well the donors would do, although now we know they do very well indeed. And so I developed from the very beginning a sense of tremendous respect and gratitude to the living donors. They're magnificent. And Dr. Rickard, from who you just heard, is one of them. And I respect people like him a lot. what they've done is magnificent. And it's a great example of respect of one person for another. Because of course, as it has been said, it isn't really for the donor's health. It's for the recipient's health, and they're in desperate need. So it makes a huge difference. And the donor process is now very safe, we're very well regulated, and very effective.
Great. So I think we have an audience here. It's an honor to be here with you today and chat about donation. Can you share from your perspective some words of wisdom for our potential donors that are out there?
Well, I think they would join a marvelous group of heroes to do that. And my experience is the donors are almost universally very pleased and satisfied that they've made such a tremendous contribution to somebody else. And that's why I respect them so much.
That's great. Well, thank you so much for being here. It's really an honor, given my experience in the field, to sit with someone as like you, who has done so much to move our field forward. And we want to thank everyone that's tuned in today to Mass General Facebook Live in our Transplant Center, and we hopefully will see some of you soon in our clinics.